What's up guys, I'm Dr. Nick. Thanks for tuning into this video. I've got another special guest with me today. Who is it? Stick around and you'll find out. In this video, I have a special guest with me. It's my wife, Julie Campitelli. Can you say hi, Julie?
Hello everybody.
She actually is the one that got me started doing these videos. I initially started just doing some surgical videos on this channel, and she's like, you need to educate a lot of your patients and the rest of the community out there on what you do. So we started doing these videos. So it's her
brainchild.
She created it, so I'm so thankful that she made me do this. Isn't it fun?
Yes.
She said she'd never be in a video with me, but here she is. So what are we talking about today? Something important. She's had problems. Imagine that. A podiatrist's wife has foot problems and they actually needed surgery. So why don't you go ahead and tell everyone about your problem?
So I am a runner and I run a lot, and I run a
we
bunch
run together,
yes,
actually.
Yes.
Stresses me out sometimes.
We've run a few marathons together, and I think over the years.
How many have we done? 10? Maybe. I think you did one more than me.
I don't know. I thought 6, 8.
No, you've done more than me because I actually stopped my last one and she kept going.
That's okay. So, but over the years of running, I have had some terrible pain in my big toe joint. Why don't you tell them about that?
So, the big toe joint is the most common joint to get arthritis in, and we call it hallux liminis. Doesn't matter. Hallux is the big toe. Anyway, you get arthritis in the big toe joint, most common joint of the foot to get arthritis, and it's actually genetic with Julie. Her mom has that same problem. Her brother had the same problem. So about 5 years ago, her right foot was really bad. And just to kind of simplify, what happens is, if this is a side view of the joint, this is the head of the metatarsal, and this is the bone in the big toe. Instead of it moving and articulating like this, it starts grinding, and you form these bumps on top of that joint. And that's what happened with hers, and it got so bad that she had bone rubbing on bone. There were fragments, so we had to get them out of there, and she had surgery. I actually did the surgery on her right foot. This is a very stressful time. It's not fun operating on your family members. This is a good time to talk about that. Why do you not want to do that? Because, you know, it's a human body, and we're all trained when we operate to forget about feelings and to just do your job of cutting and dissecting and doing surgery. But when it's your loved one or a family member, it's hard to put those feelings aside to operate. But she told me she wasn't going to have anyone else do it.
Right, and he did a really good job, because that screeching, horrible pain in my toe, every step I took was just so painful, it all went away.
Thank you.
And then,
could you imagine if I would have not been successful?
Then 5 years later, my left toe started to do the same thing. I had that big bump on top of my toe in the joint, and every step I took was a screeching pain. I could barely wear shoes to work. So this time I had one of my partners do it. And he did a great job too. And the pain is gone. It's been 5 months. And if you can zoom into both of my scars, like 5 years ago and 5 months ago, both procedures tremendously helped. So this is 5 years ago that Dr. Nick did. And then this is 5 months ago. So it's you say.
How long did you wait after your surgery before you started running again?
For my right foot, it was very soon. Was it 3 weeks? No.
I usually say when the incision heals and you feel like running.
I think it was 3 weeks.
Probably.
But this foot, I waited 5 weeks. So, but I was up and moving and walking, so that was okay. But I know I was definitely up and going quicker.
So why don't you tell everyone what you do for a living?
So I'm a school teacher. I teach first grade, and I'm always on my feet all day, nonstop running around the school, my classroom, up and down steps. And again, I told you that I wore work shoes. You know, they're not like high heels or anything, but even flats, ballet flats, I couldn't even wear those because my foot hurt so bad. So I would wear Toms all the time. Those are the most comfortable. And I also have bought a pair of Hoka running shoes.
Hokas.
And those are great. we walk our neighborhood in those, and I've run in those. So
she tried an injection too. You can't forget that. We did some
Yeah,
cortisone
that's right.
injections, which will give temporary relief. Doesn't fix the problem, but it buys some time before the surgery, or if you're thinking about having it done, it can, you know, extend that time period before you have the surgery.
Yeah, but the surgery was definitely the best solution, even though I didn't want to be laid up for 5 weeks with no running. It totally helped, and now I can wear any shoe. I can go shoe shopping, and I can actually put my left foot in a shoe without it hurting. So
we actually, when her brother, he had the surgery done, how much?
He actually was 3 weeks after my procedure, and he lives in Oklahoma. So he had his foot done. I think it was his right
It
foot,
was his right foot because he couldn't drive.
But mine was obviously left, so I could.
And her brother, I was going to do her brother's toe. He made he had plane reservations to come to Ohio to have this done. And we had another wave of COVID, which kind of shut the airline traffic down and traveling down. So he didn't make it. So I didn't get to do his toe, but we would have had a lot of video. We would have been able to show everyone what we did.
Yeah.
But I will say her brother took pictures of his foot every day after surgery. And we have all of those. So I'll make sure to either put a link in this description or have you click on one of the videos here if it's done at the time this video gets released. But if not, we'll get it done so everyone can see each day what it looks like as you're healing for this process. So if you don't see it now, check back to this channel. We'll have it uploaded at some point. Anything else you want to tell everyone?
No.
How you make fun of me when we do all these videos?
Well, that's a given, but.
Well, thanks for stopping by. Thanks for watching our special guest, my wife, with this video. Please make sure to hit the like and subscribe button. We need subscribers to keep this channel going. It helps to push more videos through. And when you subscribe, and especially when you like, more people see the videos. And the more people that see them, the better the channel does and the more videos we'll upload. So thanks again. You can click on some of these other videos we have posted here. They may be interesting for you. And if you have any questions, just drop them in the comment section below. We'll see you soon.